Next on the programme, there's been a development project in rural Burkina Faso which has surprisingly helped save thousands of lives. It's all through a mass radio campaign, and it's targeted three of the biggest killers of children, like Marieta there behind me, under the age of 5. And as you can imagine, some of those diseases includes malaria. Now, it educated their parents on the symptoms and also encouraged them to speak to each other and seek medical treatment. The BBC's health correspondent, SHEEHY-SKEFFINGTON, has more.
In her village in rural Burkina Faso, Marieta is known as the child of the radio. That's because her dad says the radio saved her life. When she was just 1, Marieta developed a high fever and became very unwell.
I consulted traditional healers and spent most of my money on traditional remedies and medicine I bought at the market. But nothing worked, and on the 6th day, she fell into a coma.
Then Marieta's father heard a radio campaign warning parents to watch out for signs of malaria, pneumonia and diarrhea, 3 of the biggest killers of young children in the country. The campaign was part of a huge experiment broadcast on 7 local radio stations for 3 years.
If you're the Minister of Health of a typical African country and you have $30 to $40 per head of population to spend on health, you're literally deciding who lives and who dies. And so anything that you spend your money on has to be proven, and this has not been proven until now. It's simply never been proven that mass media can change behaviours, let alone save lives.
The number of children like Marieta who were seen for malaria rose by 56% in the first year, and consultations for diarrhea and pneumonia increased too. It wasn't just one-way messages. Parents had the chance to call in to interactive shows, sharing questions and concerns.
They've also worked with local people in developing scripts and dramas and stories that are really engaging and get people's emotions going and make it much more likely that people are going to behave based on listening, as opposed to just thinking that it's information given to them from some expert.
This campaign may have worked well in a rural area where almost everyone listens to their local radio station. The question is, would it do as well in parts of the world where TV stations and the internet all compete for people's attention? And media messages can only do so much. Good healthcare is crucial. But while children still die from avoidable illnesses, hearing the right information may help save lives.
That report there by SHEEHY-SKEFFINGTON.